Integration Station. I am Michael, a child and adolescent occupational therapist, and with me today is my co-host, Eleanor, who is also a child and adolescent occupational therapist.
Hello, everyone. What are we going to be talking about today, Michael?
Well, we have a lot of things on our list today. We've got 3 questions, plenty of stuff there to cover. So anybody that's tuning in for the first time, we do have a Q&A format. Those who are familiar with it, we'll take your questions, we'll throw in some of our own, and hopefully find the fun in learning how to support the young people in our lives. So if you do have any questions, you can send them through to OTFC Group on Instagram or podcast@otfcgroup.au, and we will filter those and hopefully answer as many as we can. So I will pass over to my boss, Eleanor, who I knew she was going to laugh at that one.
Oh, no.
I know. I was saving it for an appropriate time. We've got 3 questions today, 3 different ones. One is about how to get someone to re-engage in therapy when they've had trauma or a bit burnt out with therapy or just bad experiences in the past, which is a pretty big question.
Yeah.
And that actually came from a parent. And so that was a really, a really poignant one for me to throw in and like to at least give some airtime to. Another one, where is it? This other one here was about SPD, sensory processing disorders or sensory processing difficulties, presenting as attention difficulties. You know, we often have people have assessments and they suggest that there are attention difficulties, but when you go through and have a look, there's quite a few sensory processing challenges.
Yep.
But the first one I was going to start with is a auditory sensitive question. So the question was, why auditory sensitive kids tend to make a lot of noise themselves? So auditory sensitive kids making a lot of noise themselves sounds strange, right?
Yeah.
If you're sensitive to noise, why are you making a lot of noise?
Yeah.
So people are thinking, if there's a sensitive kid, like why would they be doing that? So that's a very reasonable question to ask. I think I always come back to the why behind particular behaviours, and I think if anything from our podcast, if you will, is you sort of said it. Behaviours are a form of communication. So that young person is trying to communicate something and they're making noise for a reason. So I always come back to this noise when you're in control versus noise when you're out of control.
Yeah.
So making noise yourself looks very different to a noisy environment.
Yeah, definitely.
So some people are quite comfortable being involved in a very noisy space and can tolerate and filter that okay, and then others find that really tricky. And you might get different responses here. Some kids might avoid going in there, and some kids might go in there really rambunctious and loud and try and make a lot more noise themselves.
Yeah.
So noise in control versus noise out of control.
And I think along the same line is a noise that you anticipate and you're creating versus maybe louder, unexpected noises, which does speak to that control. But if that's noises that you're creating yourself can make more sense of, and it feels more predictable potentially than what's happening in the space around you.
Yeah, and I think that's exactly what that control element is if you're able to control as much of the environment as you can, then the anxiety is lowered.
Yeah.
The arousal level lowers. And if we think back to one thing we use a lot of, and those who've maybe seen any of our assessment reports, or you can look it up, it comes from I think it's Schellenberg have a sensory regulation graph that looks at arousal, modulation, arousal, attention and learning.
Yeah.
And when I'm thinking of this question, auditory sensitive kids and making noise, I'm thinking of, well, if the noises in their environment are quite overwhelming, that means that those parts of the brain are really struggling to manage that arousal level, so that arousal level starts to spike. And so what they're trying to do is bring that arousal level back down by doing something to control the environment or regulate their environment.
Yeah.
And that's to make noise. And that's one interpretation. So some people might also see making noise as this person's seeking noise. And this often I get the same with seeking tactile input or any sort of sensory input. They're seeking it because, they're accessing that input because they're a seeker.
Yeah.
When actually a lot of the time it comes back to a bit more of a complex exploration of that, to actually break it down. Well, when are they seeking it, and looking at those situations to go, are they actually seeking it, or are they just trying to put in a sensory response to provide some predictability to their environment?
And maybe they're using that consistently across different settings if that's regulating for them.
Yeah.
Whether it's, I don't know, just thinking of something like humming to themselves or creating a different sensory opportunity than what maybe the space is able to afford for them in that moment. I guess there's also a social element too, right? So yes, there's a sensory component, but I'm thinking about this not only in making noises, but perhaps not always being aware of their voice volume when they're talking or interacting with others. I've got a beautiful young person I've worked with previously who would be the first to voice, I think, if others in the space were feeling too noisy for them. So that seems like a bit of a juxtaposition, doesn't it, when she's someone that finds it tricky to tolerate when others are being really noisy in play or in communication, but then might present quite similarly herself. But for her, I think she's not always aware of what that's looking like. And it's different when you're the person that's potentially instigating or in control of what this looks like versus how it looks and feels when you're on the receiving end, and then matching that dialogue of, well, you know how this feels when others might respond in that way, to then be able to talk through the why of what's contributing for her in that moment. So I think that's always an interesting piece as well. It's just about providing, some supports around that, unpacking that with them, seeing what they're needing, and seeing if that can help shift things a little bit too.
The other thing with noise is that if you think about the times when you're quite startled, noises tend to be one of the biggest sort of startling factors. So the sound of a firework, a dog barking, like it triggers that fight, flight, freeze response really quickly. So it makes sense as to why auditory sensitive kids might be trying to pad out noises to reduce startling noises maybe coming into play as well. Again, that's just an interpretation, but it certainly makes sense because it's tapping more into those, the amygdala and those parts of the brain.
And the survival responses.
Yeah, exactly. There's those primitive parts that are there to protect you. And all that, people see here is this person's making noises to cover, for whatever reason. But the way that I see it is they're making noises for a purpose. They're doing it for a reason. And their brain and their body is just telling you need to do this to protect yourself.
Yeah.
You need to do this because there's something in this environment that's making you feel unsafe, or I think I'm going to go into an environment that's going to be unpredictable. Therefore, if I do this, it makes it more predictable.
Yeah.
And again, it comes back to that ability to modulate. We talk about it a lot, being able to filter in and filter out things, and how to manage that from, to reduce that level of anxiety.
Yeah, for sure.
So, I think there's a lot there, and that's probably just touching the
I know.
surface.
And I think there's been, there's a few whys within that, right? But probably shows the complexities when there's something that we're observing, there can be so many things underpinning at that point in time that's contributing to that. So our jobs as the people who are working in these young people's support network is to try and understand what that looks like, because then potentially what we put in place to help them might not be as supportive as we were hoping for if we haven't tried to work a bit back from there to understand the why.
And I guess that comes back to assessing and making sure we have the data about that person to help provide clear goals or clear outcomes.
Yeah.
Trial and error and a few other things to see what works and what doesn't, and go from there.
Yeah, you can't know until you try. So if we're talking about a young person who's making noises themselves, although they might manage some auditory sensitivities, is it something that they're doing because it's a sensory seeking behaviour?
Yep.
Are they trying to regulate in an environment that maybe feels a little bit more overwhelming? Are they looking for a moment of control themselves in a space that feels unpredictable? Are they not necessarily aware of what that action looks like and how that relates to the things around them? And what are they needing in that moment?
So that's auditory processing. The next one's about sensory processing. And I guess sensory processing difficulties, auditory sensitivity or auditory defensiveness can certainly come in that sensory processing, I guess, heading, if you will. And for anybody if you want to go into a deep dive, you can Google sensory processing difficulties or sensory modulation. There's a whole list of, I guess, terminology there that at times I think can be confusing for people.
Yeah, especially when things are used interchangeably as well. Yeah.
And there are different theories, I guess, or people who have different ways of labeling that and identifying that. And that has been something, just as a health professional working for a few years in that field, particularly in OT, it's been hard to find common ground there and to go with that. But I think here we generally talk about it as like a sensory processing difficulty.
Yeah.
So that aside, sensory processing difficulties presenting as attention difficulties.
Yeah.
So we do a lot of assessments here, and those who know, we do the easy assessment as probably our most thorough assessment of sensory integration and sensory processing skills.
With a young person who's at that age.
Yeah.
To be able to undertake that.
Correct.
As we
Yeah.
would expect for that to be supportive information.
Yep. So coming from that perspective, what you might see is someone who is coming with concerns around their ability to attend, their ability to take in information, maybe difficulties in the classroom, with learning, and it can be interpreted as this person doesn't have the right or doesn't have the skills or the attention levels that is required to learn in the classroom.
Yeah.
Or can at times, it can't sustain that, or whatever the case is. But then when you do a assessment, I guess for us that comes back to the importance of our assessments or importance of assessments in general, is that you will see from that there are sensory differences or sensory processing differences that may be a strong contributor as to why that person is finding things harder.
This question always reminds me of a young person I used to work with. You assessed him actually.
Okay.
And he had been referred for OT input because they'd been exploring with their paediatrician as to whether he might fit the criteria for ADHD. And he was finding it hard to sit still in the classroom, often on the move, was finding it tricky to work through learning tasks, that kind of thing. But they wanted to explore OT input first before going down any further diagnostic pathways. And through the assessment that we had done with him, he did have some areas in those sensory processing profile that were trickier. And so essentially what he's was finding it hard to do was integrate all that sensory information from his environment, process and organise that, and then the skills that kind of come from there in terms of what supports him to sit still at the table, the visual skills to manage things in the classroom and learning tasks, the auditory component to be able to follow instructions, and that provided these clear guidelines for us about what we could support within OT. And after really channeling some of those foundational skills, we revisited that conversation, and it was just that his body was working so hard to compensate, override some of those challenges that he was navigating in his foundational sensory motor or sensory processing and sensory motor skills. And that with those supports in place, he had been able to engage better in the classroom. And they actually looked at that from there going, okay, so perhaps it wasn't underlying ADHD. It's actually just these sensory processing, well, not just, it's these sensory processing difficulties and differences that were making some of these things trickier, but having a better understanding of that and putting those supports in place, we've been able to work towards those goals for him, which is really positive.
And I think that's a good point that you mentioned. So in that I'm hearing there's that combination of the sensory modulation. When I refer to the modulation, it's the environment that we're in.
Yeah.
So can I filter out, and I've sort of said this a few times in the past, but can I filter out things in my environment that aren't necessarily going to help me do the task at hand or process what I need to process at that time? And for example, that could be, am I able to listen to the teacher and filter out the other children around me in my classroom? That's a good example. And going back to the auditory sensitive one, that could be really tricky. Then there's the sensory processing skills. So the easy assessment looks at that to go, does this person have the ability to sit still? Does their posture allow them to do that? And so when you factor both of those in, it certainly makes sense that it could look like an attention difficulty because they're finding it hard to listen to instruction. They're not able to process that. And they're wriggling around and moving or getting up out of their chair. And so someone goes, oh, well, they can't pay attention.
Yeah.
But as you said, it could just be their body is working so hard to allow them to pay attention in this environment. Let's go down the avenue of what can we do to support their sensory needs, and will we see a change? And that's where I always think that's the first. And that's why a lot of GPs and other health professionals refer to OT first to say they're too young for an ADHD diagnosis, but there's something about their inability to attend compared to their peers, which would suggest that there's something going on.
Yeah.
Is it a sensory thing? And I think that's a good way to start.
Yeah. I think good to kind of, even exploring that conversation, that can be a good thing to help in understanding where those needs are and either going, actually, these are things that we can support within OT, or the foundations are actually quite strong for their age. So is there something else underlying that might be contributing to that? What else could we be putting in place? It's just, speaking of the whys that we were talking about before with the auditory sensitivities, it's the same in this situation here. For what you're observing with those difficulties with attention, what might be happening underneath for them that's making that hard, and try and help support those next steps.
I wrote down the word observing. I think that's really key, because I think sometimes the most important thing is just to observe and take stock, or look at some patterns, or when it's happening and how it's happening and what's going on. And sometimes if you spend enough time observing that person, then you can get a better idea of, okay, each time this environment occurs, this happens.
Yeah.
Or each time we have to sit for half an hour or longer, then I see some attention difficulties.
Yeah. Every time I ask them to write or draw something for me, all of a sudden they're interacting with those around them and they're looking to do other things. So are they actually, it's not an attention challenge, it's an avoidance.
Yeah.
Because that's something that's really hard.
Yeah, exactly. And I think that can give you, without having to go down a massive sort of route of, does this person have attention difficulties? Do they have this? Do they have that? To go, let me just observe them for a while, take some data, and then I can come back and say, okay, I've noticed this. And then you can provide that, say if you're a teacher, or say if you're a parent, you can provide that to someone else to go, this is the data I've got.
Yeah.
And so you might go to a GP and, say, look, I'm noticing these things. Or if you're involved with a health professional, say an OT, you might say, I've noticed these things. What could it be? And that can certainly help provide some more clarity around maybe what's going on. And as you said, the why.
I think sometimes people come through too, and their primary concern is with attention difficulties, and then potentially they're saying, well, I'm not, they appear quite coordinated, they like certain things, but then actually when you do that deeper dive, you're kind of realizing, they do tend to, they're utilizing their strengths, they're sticking to things that they know and love, things they have the chance to practice all of the time and hone those skills, but other things they can be more avoidant of. And then you start to say, actually, when we have tried this, they found that trickier, or they don't normally go for that on the playground because it's something that they're not as comfortable with. And so once again, it's just about putting that picture together.
So then on that, just one last quick question then, because this might help the person asking the question, differences that you might see between someone who does have an attention difficulty and what might be a sensory processing difficulty.
I think really important to note that, as OTs, we're not diagnosticians.
Sure.
But it's just working with lots of young people and having that experience and helping to support that understanding. We do sometimes have young people come through that, if perhaps the attention challenges is what has brought them to OT, but then we're doing this profile and we're going, well, actually, I'm not seeing within that the sensory processing differences would be contributing to that. And then we're doing something like a sensory processing measure, a sensory profile, to look at the modulation piece that you spoke to, how we filter and make sense of the sensory information in our environment. And if there's no huge red flags there, or potentially there is, it's just putting it all together to go, well, is there something underlying?
Yeah.
A neurodevelopmental difference that might be contributing to that. And actually, it's not that they don't have the skills that they need to do the things in their day. It's just they're battling against their own body and neurochemistry in order to do that potentially. And sometimes that can just be a really open conversation with the families, knowing that, of course, it is always up to them how they proceed with that information, but framing that to say, this is what I have observed, this is the data that I have. I do wonder if potentially there's something else underlying here, and then seeing if that's something that we're wanting to explore. I think at the end of the day, it doesn't really change how we're supporting that young person and knowing their strengths and all the things that make them the awesome, unique humans that they are. But if it supports that holistic understanding, that could be a supportive next step to be referring them to someone that might be able to unpack that further.
Yeah, and I guess in that way you're saying, is it an attention difficulty or an attention hyperactivity disorder or something?
Or even learning differences as well, I suppose, can present as attention challenges.
Yeah, and I guess any of those differences under that, that neurodivergent umbrella would certainly look in a particular way and can be interpreted in a particular way. And so within a classroom space or a home environment might look a particular way. And so, for me, I guess your point is valid. It just comes back to doing those assessments and taking that data and being able to say, well, this is what I see from the data that we've got from a sensory perspective, but you're still experiencing these challenges. Therefore, maybe there is something more. Yeah. Maybe there is there.
And I feel like we've pulled up the string a little bit here, but there's also that piece too of how regulated we are, how organised and settled we're feeling in our body then impacts upon attention. So the sensory regulation graph that you'd spoken to previously, when I think about when those arousal levels are shifting and we're entering that more heightened state, that can present like attention difficulties. So actually is there opportunity there to support the regulation side of things and see that shift in attention? Because when we're dysregulated, the expectation to sit and attend within something that we need to do can become really unmanageable.
And sometimes, and this is not, medication is not for everybody at a particular age, but sometimes what I notice is that those that do have attention difficulties and they do take medication and it works and it helps, that's often a very clear sign that there is something underlying there that's helping for them. But at the same time, that's not everybody's path, and that's completely fair. And like anything, medication is not the cure-all.
No.
Medication can help for some people, but there are certainly other strategies and other approaches that are needed to make it as holistic as possible for that person.
For sure. And we do actually have, I think we have some families that come through that maybe have gone through that pathway for ADHD and they're looking to explore non-pharmacological options first.
Yes.
Which, of course, there can be a ceiling to where sensory strategies and supports alone can facilitate that, going back to the point we made before about just that person's neurochemical makeup and how to support within that.
So some of these people have often been through a range of services and gone through assessments and other things. And we do see young people, and I think maybe more so at the site that I'm at Mile End, where we've got young adults or teenagers that have experienced a range of services over their time, and they're kind of, you could consider they're burnt out from therapy. Or they have had difficult experiences in the past, which has meant that they have a lack of trust in engaging in therapy. And that comes back to the final question, which is how to support someone to re-engage in therapy. When clearly there is a need, and to some extent that person might see that there is some need for it, but the family certainly identifying that there are a lot of challenges still going on. That means they can't be the person they want to be or do what they want to do. But they're so done with therapy,
not getting out of it what they need to anyway then sometimes at that point, which is really tough.
So how would you start, or where would you start to that path for re-engagement?
I guess you've had some people come through recently, right, for just to come and check out the space, have that low demand approach. You don't have to. It's totally up to you. Let's just come and have a look. There's no pressure, and just seeing what the space looks like. What have been the outcome of some of those conversations for you?
Look, I think the most important aspect of any approach when working, particularly with clients who may be less inclined to engage in therapy, is to try and start with one very open dialogue, very honest and open dialogue, and try and build trust from that vulnerability or that openness. So often I come in, which can be quite disarming, and a lot of clients like it, coming with do you know why you're here today? And a lot of them don't say, well, I said, it's probably because mum or dad told you to come, or someone said, and often I often get a giggle or a smile or a look over at the parent. I'm like, and they're why? Because you, as a young person, are thinking, well, why do I have to be here? And the parent's going, well, I want you to be here because I think you need the support. And a young person's going, well, I don't think I need that support. So then if I come in and go, well, I'm siding with mum and dad here,
Yeah.
then automatically I'm going to get, well, you're just another
2,
person.
3 against one.
Yeah, well, that's really unfair on that young person. Even though to some extent I'm certainly siding with the parents here to go, yep, I agree you're here for that reason. I'm also going, well, I can see why this young person might not want to be here. I just want to label that.
Yeah.
I would never force anybody to come to therapy if they don't feel like it's something that's working for them.
Yeah.
First and foremost, our therapy, particularly what we do, if it's not engaging or fun, it's not really doing what we want it to do. And I know there are trickier times, don't get me wrong, and I know there are times when you have to challenge and explore outside people's comfort zone, but it doesn't mean you have to be pushing every single time and pushing people to the limit or extending them beyond what they're capable in that moment. Everybody has their own capacity on a day-to-day basis.
Absolutely. And it's okay to take breaks as well if you're kind of reaching that point where you can see that motivation shift. We often use, I should say, the block system with sessions, and lots of reasons that we do that, where you might come for about a term's worth of weekly sessions, then you might have a similar break. So it's like a term on, term off.
Yeah.
Lots of reasons that we do it, but one reason, I think, supporting young people and families to take a break from the therapies that they're accessing so that they can recharge, do the other things that they need to do as a family, work on other supports that they might be accessing, whatever that looks like. So hopefully when they come back, they're feeling a bit more recharged. Maybe they've even been missing OT and they're ready to go again, and they're motivated and they want to be here. But I think when that starts to shift and it's a push for everyone, it's another demand they have to manage. I'm making an assumption that quite possibly there are other things that they're managing across their day where they feel like they don't have control. It's just, trying to find that balance, but making it safe if it's someone that maybe hasn't accessed the space before, to reduce demands, make that a low pressure. Just come and check it out. Come and meet people. You don't have to make any decisions, or let's just try for a block. If you really don't like it at the end of that, then we can explore other options. How can we make this work for you?
And I think that's where it comes back to, if I'm thinking of, any sort of policy or literature around the right of young people, is to give them the right to make that decision. And I want to advocate for any young person, and I want them to make the choice, because the therapy and what we do together, if it's a one-on-one space, it won't be as effective or as meaningful for that person if they don't feel as though they've had a part in making
their
the
voice
decision to come.
needs to be heard as part of the decision making.
Yeah, and I think as and this starts at a very young age, very young age. The fact that you have a teenager that's voicing they don't want to come, you could have a 5 or 6 year old that is finding it hard to get to therapy, and unless you have those conversations about why, it's the same as refusal for going to school or difficulties attending anywhere. Like having that conversation as to why, or being able to unpack why, will give you the ideas about, okay, where do we start to find the support to make it more engaging or motivating. Yeah. And if you've had previous trauma from over therapies or whatever that looks like, or really bad experiences, then it's about trying to start with trust and trying to rebuild that trust with that person.
Yeah, for sure. And I think if something's not working, being able to pivot from that and go, well, what are you hoping to get out of it? What can we be doing together? How could I make this look different for you? What you're wanting out of this? I had that exact conversation with a client yesterday who was, a teenage boy, came in and he's having these conversations with mum on the drive-in, and I thought that in itself was really encouraging to go, I can talk about this. And it was pretty much I don't think I need to be here. Yeah. And this is kind of a separate question, but it's stemmed from previous experiences in therapy that I don't think they get me. I don't really think this is working. I'm not seeing any benefits. And it's just sitting with that and going, okay, what do we need to do here? Yeah. Like what do you want to get out of it? And sometimes these young people don't know. And that's where I think it can get tricky, because if they're not quite sure, then it becomes tricky to find a plan that works for all parties involved. But it doesn't stop a process of exploration. It doesn't stop a process of the conversation. It doesn't stop an idea of what
what do you want to do? What do you like to do? And are things preventing you from doing what you want to do?
Yeah. I think I've been finding myself more saying assessments for young people that are coming through for the very first time, because you ask them, what do you think OT can help with? And you're so right that it might be mum or dad that suggested it or someone else. And I'm just talking generally and going, sometimes OT can help with, for those that want to build their physical skills and their strength. Some people come to OT because they want to work on how they identify emotions for themselves and the tools that they can have to support that across their day, or maybe they want to build their confidence in interacting with other people. I start to list off these things, and sometimes I find giving those broader examples then helps them go, oh yeah, actually now that you say that could be really helpful. Yeah, I do want to build my functional independence and that kind of thing. But if something's not working, I think just having that be a conversation. No, for any services that you're accessing, I think any therapies, if that young person's saying to you that they're not clicking, they're not gelling, they feel that there's a few things getting lost, then I think that's always a conversation to have, to go, it doesn't have to be, it can look different, there's other things we can explore, feeding that back to people that might be able to put some different things in place, and trusting your gut on what that feel is with the person that you're working with as well. Absolutely.
And I think that's where we 100% listen to the rights of that child to go, if they're not finding it's working, I can as a therapist try and work through that. And if even after that it's not working, then that is okay.
Yeah.
I prefer my relationship with that client is wherever it's at. And as long as they're finding supports or services that work for them,
that's all that matters. Most important. Yeah.
All right. Well, I think that's probably a good place to leave it. Hopefully the insight today gives just a little bit more of an idea of some other things and some thoughts to ponder. Yeah. It's quite a range today, wasn't there? Talking about auditory sensitivities and then more general sensory processing differences. Yeah. And then how to support young people in accessing therapy, particularly if they haven't had the most positive experiences or they're not sure what that looks like for them. Yeah, still thinking about that one. I think that's a big one, and one that I am always trying to learn from. And it just, for me, it just comes back to listening to the feedback of the young people we're with, because at the end of the day, it's their lives and I'm just a small part in that. Yeah, maybe we can even revisit that too, especially when it's, I think, that the young person that you'd mentioned that was saying, well, I'm not sure what I'm getting out of this. I don't know why I have to come. I think that's a really big question. So maybe we can revisit that in another podcast. Probably worthwhile. All right. Well, that's all for us today. But again, questions. It's what this podcast is built on. So if you have any, OTFC group on Instagram, otherwise podcast@otfcgroup.au. Send them through there. Eli will filter them if he wants to. Otherwise, I'll send them to my boss. That's you, isn't it? Yeah. Every time. And she can answer some questions as well. She likes to prepare for the pod. So one more shout out. Who's it for? Our shout out to Fletch. Glad we've got this tradition back up and running. But thanks for today, Michael. Thanks for listening, everyone. Thank you, Eleanor. Enjoy your holiday. Thank you. See you in a few weeks, all right? Thank you so much. Thanks.